fetus in place, and that's when you really want to do that detailed survey, trying to make sure that there is no structural problems with the fetus.
A sonographer will walk you through each step. She'll begin by applying plenty of harmless jelly, which helps the probe capture clear pictures of your baby in the womb. The test is painless, and studies show ultrasound is completely safe.
There are some basic measurements that we take of the fetal head, the fetal abdomen, of the fetal long bones, and that gives us a very good estimate of how much the fetus weighs, how far along the patient is in the pregnancy. Then you start looking at the anatomy in more detail.
You can see the 4 little fingers coming down there. That first little hand. So the thumb. Yeah, the thumb sticking up.
There are at least 4 views that we look at the fetal brain. We look at the fetal face, looking for things like cleft lip, cleft palate. We then move down to the chest, looking for heart defects. There's 4 different views that we look at the heart, look at the lungs. Really, we just stepwise go right from the head right down to the feet.
The doctor's the final say on all the pictures.
Most families want to know their baby's gender, but not all.
When you get down to the area of the genitalia, if the baby is in the right position, we certainly can tell if it's a boy or if it's a girl.
Did you want to know what you're having? No, we don't want to know. We want to be surprised. Okay. Healthy baby, that's what we want, right?
In 90% of cases, your sonographer or doctor can identify the sex of your baby. Still, 3% of the time, they're wrong. Some doctors like to take a quick second pass before giving you a final evaluation.
Your placenta looks fine. Amount of fluid around the baby, everything is really looking quite good here.
This may be your last ultrasound exam, unless a concern arises or your pregnancy is considered high risk.
Patients who have things like chronic hypertension, people who are pre-existing diabetics, they get a whole series of ultrasounds throughout pregnancy because those pregnancies are at risk for specific problems.
3D and 4D ultrasounds are a technological advancement in imagery. They're gaining popularity, but for most healthy pregnancies, they're not medically necessary.
If someone is going to have a 4D ultrasound, it probably would not be generated from the referring obstetrician. A lot of the places that are doing 3D, 4D ultrasound, really you're going to those places for a nice picture as opposed to a diagnostic study. Congratulations.
If all is well, you'll be going home with peace of mind and